अस्सलाम वालेकुम। इय्याका नअब्दु व इय्याका नस्तईन। वेलकम टू माय चैनल डॉक्टर शामी सेज। तो आज की इस वीडियो में 23 नवंबर सर्जरी मॉर्निंग का मैं पेपर करने जा रहा हूँ। सो लेट्स स्टार्ट। Question number one: The boy was playing cricket and the ball hit his head after MRI of the brain. Flocculondular part of the brain was found damaged. Which function will be lost? That is equilibrium. Lyme disease is caused by which of the following? That is spirochete. Amyotrophic lateral sclerosis is caused by the degeneration of the neurons in the anterior horn. The small fat filled out pouches on the external surface of the colon are called the epiploic appendages. The tear has less amount than the plasma, that is glucose. Next, question number 6: the middle carpal bone in the proximal row is the lunate. After trauma on the anatomical snuff box patient having bleed and the pain due to which structure damage, that is a radial artery. Opioids act on the mu receptors agonist. The tragus in the antihelix is derived from the first pharyngeal arch. Loss of the innervation of the foot nerve involved will be the tibial nerve. The patient whose cuboid bone crushes by the run over accident by the light vehicle, which muscle will be affected? The tibialis posterior. The cavernous sinus infection because palsy of the lateral rectus nerve involved will be the abducens nerve. The patient came with epigastric pain, heartburn. On endoscopy, perforation of the first part of duodenum was seen. Which artery is eroded in the duodenal ulcer? That is beta gastroduodenal artery. Next, question number 14: the anterior to the left suprarenal gland is the Lazar sac. The which of the following structure lies deep to and the parallel with the carotid sheath? That is the sympathetic chain. Uterine blood supplies the uterine and the ovarian artery. 30-year-old female presented the acute chest pain and hemoptysis 1 week after delivery. There is no fever. Easy shows the SQT pattern, and that is definitely appropriate investigation. The CT angiogram. The pulmonary embolism suspicion here. The patient has the uncontrollable rapid movement of hands. Even he can damage his hands. Nucleus involved, it would be subthalamic nucleus. Question number 19: increase in the ADH cause the high urine osmolarity, then the plasma osmolarity. The central cyanosis appears when the HP drops below 5 gram. When phenylalanine enzyme is deficient, then what will accumulate in the body? The tyrosine. Redman syndrome occurs with the vancomycin. Antidote of the atropine is the physostigmine. Next, question number 24: the renal failure, which cells will be affected? The peritubular cells. The polycythemia is caused by the increase in red cell mass. Increased glucose, increased fatty acid, increased growth hormone is caused by the glucagon. The Sjogren's is most commonly seen with the rheumatoid arthritis. The patient presenting with the keratitis xerostomia joint pain is most likely suffering from the Sjogren's syndrome. The patient having the pH of 7.5, partition of carbon dioxide 40, bicarb 38. The disorder would be the uncompensated metabolic alkalosis. The COPD, no metabolic disturbance, partition of the carbon dioxide of 80. What will be the pH 7.3? In acute decrease in the arterial pressure, mean arterial pressure. The elicits which of the following compensatory changes the decreased firing rate of the carotid sinus? The potassium is 3 milliequally due to the increase in the aldosterone. The patient was taking glucocorticoid. Rapid withdrawal will cause death due to the suppression of adrenocortical system. The cervix has squamous epithelium. This is due to the metaplasia. The non-diabetic female having chronic sinusitis developed the fungal infection that shows the septate hyphae at the acute angle in the producing respiratory symptom. Most likely the fungus is this is Charlie aspergillus. 35: the glomerulonephritis polyangiitis is associated with the CNCA. The obstructive lung disease will have the FEV into FVC ratio less than 70 during acute asthmatic attack. Which test will you perform? That is FEV. One, long-term use of the intrauterine device cause conversion of the normal simple columnar epithelium of the endocervix to stratified squamous epithelium. This is an example of the metaplasia. The biopsy of the stomach done. There was non-specialized gastric tissues in the scatogoblet cell. This is related to the metaplasia. The patient has the lower respiratory tract infection for the many days. On histology, respiratory, which of the following will be damaged? Cilia. Naturally occurring antithrombotic is the heparin. Most widely used technique to detect the tumor cells is the peripheral smear. 43: the submandibular gland lies at the mandible angle. Surgery of this will lead to the damage of which structure adjacent to this? That is the facial. Next, question number 44: the ascent of the horseshoe kidney is prevented by the inferior mesenteric. Next, portal vein run in which ligament? The lesser omentum. Two vertebral arteries join to form the basilar artery. This is called the conversion. Decrease in the size of the uterus after 10 days of the delivery is 5 to 10 gram. What will be size after 6 to 8 weeks. 60 grams. The feature of the acid fast bacilli in the TB is the mycolic acid. The patient after RTA had the severe blood loss and no urine output. Even after 3 days, the patient failed to have the urine output. Cret 9.5 biopsy shows the cortical necrosis in the severe acute tubular necrosis. What is the cause in this patient? That is the irreversible injury. The optic canal contains which of the following? The ophthalmic artery. The 51. The patient's ECG shows the prolonged PR interval. Echo shows no ventricular hypertrophy. Left axis deviation seen. This is which block? That is the trifascicular. The patient is having the pain in the groin region along with the infection of the big toe. This is carried to which of the following lymph nodes? That is Charlie, which is the ventral group of the superficial inguinal lymph nodes. The plexus at the bifurcation of aorta. Which nerve form this plexus to the lower plexus? That is the hypogastric plexus. Thoracic vagotomy result in the decreased gastrin secretions. The pancreatic magna is the branch of the splenic artery. The young lady has a gallstone which has caused blockage of bile duct. This will lead to the increased fat contents of the stool. Which of the following is a type of Hodgkin's lymphoma with EBV, Epstein-Barr virus? That is the nodular Hodgkin's lymphoma. Baby has the jaw lesion. It is caused by the Epstein-Barr virus. The drug used for the treatment of an acute attack of migraine after paracetamol ineffective would be the sumatriptan. The patient with acute appendicitis pain for the last 18 hours on pathological examination seen would be neutrophil in the muscular wall to calculate the inspiratory capacity. Which values should be known? IRV and the TV. Next, 22-year-old primary gravida has noted no fetal movement at 18-week gestation. The fetal ultrasound examination shows the marked hydrops fetalis and organomegaly. There is extensive cerebral necrosis in the periventricular calcification. Infection with which of the following organism is most likely to produce this finding? That is the cytomegalovirus. Descending thoracic artery begins at the lower border of the T4. Transverse mesocolon is attached posteriorly by the second part of the duodenum. The infection of the neck in front of the pretracheal fascia will spread to the anterior mediastinum. Apex of the heart blood supply would be the anterior interventricular artery. The pain, temperature and the crude touch loss, it is carried by which of the following tract? There is an anterolateral spinothalamic tract. The posterior pituitary tumor cause which of these affects the polyuria? Which of the following increased stomach emptying gastrin? Next, 70. The patient undergoes gastrectomy, develops the macrocystic anemia. Treatment should be the injection of vitamin B12. After ileum resection following will occur steatoria. Next, steatoria is caused by an activation of pancreatic lipase heparin activate which of the following? The antithrombin 3. The characteristic feature of the hemophilia is the tissue bleeding. The patient was given the penicillin for some infection because allergic reaction respiratory spasm. This will occur due to the IgE. The patient of the COPD with no metabolic disturbance, partial carbon side of 80. What will be the pH? 7.3. What is released from the Refi Magnus 2 pain inhibitory fibers in the spinal cord? That is the serotonin endorphin concentrated in which part of the brain? That is the hypothalamus. The renal plasma flow is measured by which of the following? PAH. The patient known case of the gastric ulcer now presents in the OPT with the complaint of the joint pain. Drug of choice will be the celecoxib, the drug that increase the gastric emptying and increase lower esophageal sphincter tone. Metoclopramide, the estrogen and the progesterone produced in the last 7 months by that is delta, which is the placenta. Next, which of the following is used in the liver disease? Vicurium. Which drug cause the malignant hypothermia? The halothane. Excessive cervical rib rising from the transverse process cervical vertebra may cause damage to the T1, the posterior external arcuate fibers. Another name for the cuneo-cerebral tract, deltoid muscle nerve supply would be the axillary nerve. The patient is not able to perform the plantar flexion due to the damage of which nerve? The tibial nerve. The brain tumor immunohistopath, GFAP positive tumor of which cells? Astrocytes. The hereditary spherocytosis defective protein in which of the following? The spectin. Which one is the gram negative but catalase positive? The H influenzae. The patient having the fever, cough with sputum infiltrated in X-ray chest, gram positive catalase negative organism isolated in the culture would be the step pneumonia. The internal spermatic fascia is formed by the fascia transversalis abundant at the fingerprints of Meissner's corpuscle. Next, the Pacinian corpuscle function is to detect the vibration. Patient able to retain long-term memory to the damage of which area of the brain? That is hippocampus. Left arm blood supply is by the right MCA. The patient after RTA having the right-sided weakness in the fall on the right side. Leon is in the right cerebellum. Most common anomaly of the great vessels is found the PDA. The newborn is brought with the lumbosacral swelling containing meningitis without neural tissue. What is the most likely diagnosis of this swelling? That is spinal bifida meningeal 102. An old woman presented the bluish discoloration of hand on the cold exposure. This is due to the primary nodes phenomenon. The patient presented with the testicular mass. It was diagnosed as a yolk sac tumor. What is the follow-up marker for this patient? The AFP, the immunoglobulin present in the max concentration. The human milk would be IgA, which vascular part of the fibula is used for the bone graft, that is the middle. The obese female pre-surgery had taken the gentamicin BD is likely to have impaired the distribution. 107, the patient who is unable to button and hold pen due to the damage of the which, that's opponent's policies. Next, 108, hypocalcemia leads to the systolic arrest. The location of the superior parathyroid gland is the posterior region of cranium, the inferior thyroid artery. The patient has the palpable pruritic rash, raised creatinine with the burning feet and hand, also having urine plasma protein diagnosis is HSP. Hypokalemia occurs in acute response to the exercise. After strenuous exercise, the blood volume maintained by the increased renin. 113, the right and left subphrenic space is divided by the falciform ligament. The patient presents the ER with the B string, that is the IgE. The PBD tuberculin test done to patient after 40 hours. The 15 mm arrhythma is noticed. Cells responsible for the arrhythma or helper T cells. Negative charge of the base membrane is due to the heparin sulfate. The proteins does not get filtered into the glomeruli due to the base membrane. The difference between the PCT and the DCT would be the PCT has the brush border. Next, while during the surgery, the splenic vessel need to be ligated. They are present in which ligament? That is the linorenal ligament. After RTA, the patient having talk but making no sense and able to understand sometimes damage to the area would be the vernix area. The site of murmur for the aortic regurgitation is the right second intercostal space. The premature baby born has lungs not fully developed. It leads to the ARDS. The ductus arteriosus closes shortly after the birth. The woman has a tooth extraction and she was prescribed calcium multivitamins antibiotic. She was already in the canesartan. Canesartan affects the efficacy of the which antibiotic? That is the oxytetracycline. In which condition both female and the male child are affected with the skip generations X-linked recessive. The condition with the heterozygous child are also affected. The parents will be male and the female, both are affected. The only one parent affected MSC function is the immune recognition hyperthyroidism. Which receptor will affect heart? The cardiac beta adrenergic. The chronic cold adaptation occurs to which one of the following mechanisms? The formation of the brown fat. The hyperemia is seen in the child speaking loudly. What best describes the hyperemia? That is active process. Next, 131, the motorbike rider falls from the bike with a heavy bleeding. Bioreceptor will diminish the venous compliance. The 70, a young patient blood pressure is the 150/95. His serum renin is higher than the normal. Which of the following stimulus for this increased level of the renin? That is sympathetic stimulation by the renal nerve. A diabetic patient with abdominal pain, severe vomiting, visible peristalsis, and audible sound on the examination. The condition would be the pyloric stenosis, ST release, and the carcinoid syndrome is caused by which carcinoma? The small cell carcinoma. The safe drug pre-operatively for the chronic liver disease is the fentanyl. The sampling in which the every person has the equal chance of the selection in the population is called the random sampling. The male and the female patient divided into groups, then subgroups. Which type of the sampling is this? The stratified random sampling. The patient presented with the hepatitis viral markers negatively. ALT slightly raised on examination. There was KF ring seen. But the following is the diagnostic test, that is urinary copper. The DNA is often damaged, causing the carcinogenesis. The following is the DNA repair gene. The P53 thick saliva is caused by which receptor which are same as in the adrenal gland? That is the alpha 1 beta 1. The vasoconstriction is caused by the ADH. Next, the decreased height and the slope of the action potential is due to the hyponatremia. Exosecretion is caused by which ion? That is the calcium. Local lymphatic obstruction is caused by the combination of which two? Infection. The neoplasia child have the non-fever diarrhea for the many days. The microscopic comma-shaped organism. The vibrio. The student went on the trip. In the trip, students were advised not to eat unhygienic food, but one student ate chole from the shop, started abdominal pain at the night. Which nerve is involved? The splanchnic parasympathetic. The patient moved from the spine position to standing position. Compensation by which of these increase heart contractility? 148, the boy with the uneventful tooth extraction presented with the very next day with the bleeding. Likely reason would be the anticoagulant effect. A 9-month-old girl was vaccinated 2 weeks back, now presented with the rash of the body, fever. CBC report shows HP 13.5, TLC 6, described platelets 35. Pifosmate shows large platelets, that is the ITP. The patient presented with the vascular necrosis. The femoral head artery involved with the median circumflex. The gram-negative bacteria such as the Shigella have the endotoxin in the outer membrane of the cell wall. The Shigella cause dysentery, but the mechanism of the mucosal invasion. Next, the muscles attached by the aponeurosis, the palmaris longus HIV patient who immunocompromised patient with the profuse diarrhea. ZN scan shows the oocyte 4 to 6 centimeter. The cause would be the cryptosporidium parvum. The patient the maxillary swelling on radiology, radiolucent in the radiopaque and the ground glass appearance. Diagnosis is the fibrous dysplasia. Sporting cell the par nervosa include the pituitary-ocytes. The edema anxiety in the liver patient is due to the decrease in aquatic pressure. The carbonic site is regulated by the negative feedback. The nasopharyngeal carcinoma is most commonly associated with the Epstein-Barr virus. The post-adrenalectomy patient died due to the deficiency of the aldosterone after an automobile accident. Splenectomy done after 2 months. Patient present to the emergency with the septic shock and the fever. Causative organism for this overwhelming infection would be the strep pneumonia. Epithelium of the pre-terminal bronchiole is the simple columnar epithelium. After trauma, the patient has the rustling sound and the proboscis of eye with epicleral vessel dilatation. Cause is the carotid cavernous fistula. Last 164, the glutamase aminotransferase and the alanine aminotransferase formation use which vitamin? That is the biotin. So that's it. Thanks for watching my video. Do subscribe my channel. Until my next video, Allah Hafiz.